My name is Janae Johns, president of Once Upon a Preemie and founder of Once Upon a Preemie Academy. I'm so delighted and thrilled that you took time out of your busy schedule to join us. And if we find that the policy conversation with Black maternal health leadership is made available online after our time together, we'll be sure to share it with you after this webinar. Again, welcome. If you wouldn't mind just dropping a note in the chat to let us know which organization and which state you're coming from. I'm sitting here in Philadelphia, Pennsylvania. My colleague is in the state of New Jersey. I'd love to hear from you to learn which great state and which organization that you are joining us from. We have representation from the state of Michigan and Kentucky, Newark, New Jersey, California. Wonderful, wonderful. So this is certainly a national audience for this national conversation. Who are we? Again, these are our names and the organizations that we represent. I'm going to ask my colleague, Jay Wilson, if she can unmute herself to officially welcome you to this webinar. But we come to this conversation with such passion, dedication, and commitment, not only because it's the work that we do day in and day out professionally, but we have both experienced some lived experience or some trauma during our birthing experience while Black in this country. And we bring all that we are personally and professionally to the work that we do every day within our respective organizations and as advocates to help support Black mothers and babies in this country so that other women and families don't have to experience what we did, or if they do, the blow is lightened. So with that, I'd like to turn the webinar over to my colleague, Jay Wilson, founding president and CEO of Melanated Moms.
Good afternoon. Thank you so much, Janae, for this wonderful introduction and for the opportunity to share this space with you. I'm so incredibly honored to learn more about how Melanated Moms and Once Upon a Preemie and Once Upon a Preemie Academy can continue to be the voices that moms and birthing people all need in order to feel seen, heard, and valued. So as Janae said, my name is Jay Wilson. I'm the founding president and CEO of Melanated Moms. We are a community-centered women empowerment organization that primarily creates spaces like this where we share information, where we focus on health equity, where we focus on creating opportunities for advocacy and awareness and education, and where we are super big partners in the Black maternal health solution, not just the crisis, right? So a little background about myself. I have had Melanated Moms for over 5 years now. Outside of that, I am a nurse. I've been a nurse for 16 years. I'm also a mom. My children are 10 and 13 years old. I'm also a 4-time survivor of preeclampsia. And I lost 2 children prior to the birth of my 2 girls. And going through those experiences, it really shaped my perspective of what Black maternal health really meant. In the moment, I had no idea that it was a crisis or it was anything that was happening across the country or even a global issue. I thought the situations and the circumstances around my birthing journey were only unique to myself. So for many years, I never wanted to share my story because I thought that there wasn't anyone who could understand what I was going through. In the creation of Melanated Moms 5 years ago, I was just typically just a mom looking for community. I was looking for a space that I could connect with other like-minded women that understood the transitions of motherhood and community, and just wanted to cultivate that with one another. As we started hosting social events. We started with 11 moms and just a bunch of kids. And when we would meet, we would ask specific questions about how do we create support? What does it look like to have support that looks like you? And as we kept going, we started to grow and grow and grow. And we started asking the community the question, what brings you back? What makes you feel that you are a melanated mom? Like, what are you telling people when you say, I am a member of Melanated Moms? And the surprising answer was, you create a space for us to feel safe. You advocate for the things that moms need, and you help us actually create solutions. You include us in creating more spaces to break those barriers. So as we continue to build partnerships, such as the one that we have here with Janae, we're learning more about how strategically we can build community as we climb, right? So the work that we're all doing, that it may start as an individual mission, but the spaces of collaboration is really what has catapulted both of us, both of our organizations, into a space that wasn't just recognized for our specific issue, but for the community that we have built. Next slide. All right, so what brought us to this work? So again, our lived experiences has given us our why for why this is an important space for us to occupy. But that larger conversation actually started through Black Mamas Matter Alliance and the establishment of Black Maternal Health Week. So Black Maternal Health Week was started in 2016 through the Black Mamas Matter Alliance in Atlanta, Georgia. This was recognized as a week of awareness, activism, and community building that is aimed to amplify the voices of Black mamas. So understanding how important it is to not just say what's happened to you, experience those things with other people who are like-minded, but also centering what you needed as that person that was in that birthing experience, so that you can be the voice and be the solution that another birthing person will have as a resource, is pivotal for why Black Maternal Health Week was established as a national week of awareness, right? So we see there is a lot of alignment with the work that Melanated Moms, as well as Once Upon a Preemie Academy does, in alignment with the Black Mamas Matter Alliance. So changing policy, understanding how policies interact with what these lived experiences are, but knowing that we have to also be included in the language, right? So we're going to talk a little bit about the Momnibus and the national work that's going on the federal level, but we know that having the language to include prematurity, to include the NICU, to include saying Black moms, Black birthing people, that needs to be included in that policy change, right? Cultivating research. So understanding how researching these issues, they're not just pieces of paper, right? We don't want our moms and birthing people to die in real life, but just live as statistics. We want to give them the lived experiences. We want to obtain the information from them as they are living through them, right? So that we can learn from it in real time. And then so we can use that also as an innovative method for qualitative data, not just quantitative, right? Advanced care for Black mamas. So again, knowing how that holistic space is cultivated through the people who are experiencing it. So we have to include our culture. We have to include our language. We have to include all of those parts that that impact our social determinants of health, but also increase our ability to be better, to give better care, to have more quality spaces like this to continue to create change. And then last but not least is shifting the culture, right? So redirecting and reframing what these conversations look like by including the people who are experiencing them. It does create a shift, right? But it's a shift in the right direction. It's a shift that is inclusive, that is diverse, and that shows what equity looks like, not just equality, right? Because those two things are not the same. So we're so excited to have to be a part of the foundation of Black Mamas Matter Alliance, and to continue to build our own work individually as well as collectively to continue to push these goals forward. All right. Back to Janae.
Thank you, Jay. I just have to be completely transparent with you guys. Jay and I have been at this Black maternal health and NICU equity partnership work for some time now. I remember about a year and a half ago when we first announced to the world that we were a nonprofit organization leading health and racial equity work for Black NICU families. Jay was one of the first leaders locally to reach out to me to say, hey, how can we partner within our community? We have a number of Black NICU admitted families and a number of Black moms who have started businesses and are entrepreneurs and a part of our community. We need a place for them. We need them to receive some additional supports and a place where they can begin to advocate for what they know needs to happen as a NICU admitted or preemie family. And so this partnership is really an evolution of those introductory conversations and finding the strategic opportunity and the strategic time to move forward with the relationship to support those families. And so we landed here, finding a way to give voice and opportunity and place and space for Black NICU families to advocate for their needs during Black Maternal Health Week. Why? We know that we are by default advocates, whether we were advocating for our preemie babies while we were bedside in the NICU, or whether we do things like Jay and I have been doing this week, walking about Capitol Hill virtually and introducing our work and the families' needs that we advocate on behalf of to members of Congress or their staffers. We know that ultimately we want to deepen the conversation about what Black maternal health needs. Black maternal health does not stop at labor and delivery. It doesn't stop at discharge day, especially if your baby lands in the neonatal intensive care unit and has a 1 month or 1 year or longer stay in this environment that is not always culturally congruent or culturally conducive to the types of care that Black families need. And we also know, as we've heard Jay say over and over again within the larger Black Maternal Health Week conversation, it is imperative that we center the voice of Black mothers. So many times, having worked in the health insurance space and working directly with physicians and hospitals and managed care organizations, the areas that healthcare struggles to find solutions around are within the women and families who have the lived experience. And if we are only invited to the table to be a part of the conversation, to be a part of the solution, can we get to that place of equity for all? And then lastly, because women like Jay, who's with me, and Ashley Randolph and Selena Tisdale, I'm calling out names who are on this webinar now, my partners, my industry sheroes in the neonatal space, we have the lived experience and we've created solutions to help drive healthcare forward. And so we just want to lift those up and really start to integrate what we know needs to happen for Black NICU families within the larger Black maternal health crisis conversation, because in our mind, they are one and the same. We can't talk about a Black birthing woman and the fact that Black women are 3 to 5 times more likely to die at birth than white women without acknowledging that 1 in every 5 Black babies are born prematurely and hit the NICU. And so when we talk about delivering holistic care and looking about the spectrum or suite of services that need to wrap around Black women to keep us safe during birthing, we have to include that postpartum conversation as well. And that's really the genesis and purpose of this policy note released today that we're so honored that you took time away from us to hear about. Many of you on this call know the statistics. We know that there are 4 million babies delivered annually, and of those 500,000 are premature and have NICU stays. We've already talked about the disparities, and some of you on the call are caring for these sick babies in your respective hospital or NICU institutions. And you know that some of these babies cost us as a nation because they may be the $1 million baby, like my son, TJ, who was born 14 weeks premature and had a very long NICU journey and a NICU that was not culturally conducive, culturally congruent, or culturally appropriate for what my family and I needed at that time. Although the NICU served a primarily African-American population, the healthcare team was not. There was one African-American specialist in our NICU on clinical rotation every 2 weeks. And so that cultural piece was missing, and it showed up day in and day out that I came to the NICU and saw differences in the way I was communicated with, the way diagnosis and treatments were shared with my partner and I about our son compared to our white counterparts. And this bothered me to my core. And Jay, on the other hand, as she mentioned, her why is the fact that she's a 4-time mom with 2 live children and had preeclampsia during her birth journey. And so we bring these lived experiences and these realities to everything that we're doing, not just during Black Maternal Health Week, but year round in our policy and advocacy efforts. We know that Black maternal health has a home federally and congressionally, and we're excited about that. And also in many of the states that you represent, whether your state has taken up parts of Mom the Bus or none of Mom the Bus or some of it, we know that this Black maternal health crisis is an issue that has gained a lot of momentum, energy, and policy recommendations. Many of you know that Mom the Bus is a collection of 12 individual pieces of legislation that were introduced by different parts of the Black Maternal Health Caucus, led by Congresswoman Underwood out of Illinois, Congresswoman Alma Adams, Cory Booker, and several others who have looked at the Black maternal health crisis from every possible angle to say, what is it that we need to legislate? What is it that we need to fund? What is it that we need to advocate for to make sure that as one of the wealthiest nations across the globe, we are not shamefully still within this horrible negative statistic of not being able to keep moms and babies alive because of their skin color, okay? And so many of these bills, all of these bills, all of these individual bills that collectively make up Momnibus have made it into Build Back Better, which is our current president, President Joe Biden's strategy and opportunity to help us move forward with what we need as a nation. Unfortunately, both sides of the aisle have not approved us to move forward with the funding needed for these bills. And so we need your continued voices and we need your continued advocacy to make sure that as funding is appropriated for anything related to health, anything related to public health, and in particular, anything related to the Black maternal health crisis, that these areas receive funding. We thank President Joe Biden's acknowledgement for a second year in a row that we still have work to do with this Black maternal health crisis. Last year was the inaugural proclamation on Black Maternal Health Week. This year was the second annual. And as we meet here, again, Vice President Kamala Harris and the other leaders in the Black maternal health movement are convening, talking about what this proclamation means, what this week means for us, and what we need to do to move these issues and areas forward. Which leads us to why you joined us here today. We at Once Upon a Preemie have been working tirelessly, not just for the last almost 2 years that we've been an official nonprofit organization, but since leaving the NICU in 2014, have I been advocating for these issues, not just for myself and my family, but for other Black women who have the unfortunate experience of living, breathing, and experiencing NICU and who may have experienced some unfortunate experiences based on race, ethnicity, language, or culture. And so these 5 policy priorities that we are officially releasing and rolling out to you today are a collection and a combination of both my lived experience in the NICU, working as a healthcare executive at the time of birthing my son, partnered off with everything we've been observing that over the past 2 years, leading health and racial equity training programs for perinatal and neonatal healthcare professionals that we have yet to see come to fruition in our country. And so the first priority that we are advocating for is the funding of mandating implicit bias training to address discrimination in both maternal and neonatal healthcare. As you know, Once Upon a Preemie Academy is the first virtual health and racial equity training program for perinatal and neonatal healthcare professionals across the country. Since launching Once Upon a Preemie Academy, we've exposed our training programs to over 2,500 healthcare professionals across the globe, not just here in the US, but we've touched international ground. And unfortunately, when we speak to healthcare professionals about what their hospital or what their institution is doing to mandate and require continuing education credits or credits to help them address their own bias or bias within the system, it is not consistent, it is not mandatory, and it doesn't happen on an annual basis like it should. And if we are going to address the needs of Black women who die too soon and Black babies who are born too soon, we must hold ourselves accountable for something as elementary as training on a routine and consistent basis. So we are asking that Congress lift up the requirement that every state mandate implicit bias training for its workforce who serve these Black birthing and NICU admitted families. And that this curriculum, this anti-bias curriculum, be credentialed, right? So that as nurses and doctors and social workers, you get the professional credits that you deserve for doing the heavy lifting bedside with families who may not culturally be connected with you, but who you took an oath to serve, okay? We're also looking at opportunities within this training requirement to establish mechanisms for instances of discrimination to be reported. Not every family member who's in the NICU or in the labor and delivery unit within a hospital knows that they can voice their concerns of what they experienced in the hospital during their hospital stay. And so we need to find some easier way, an easier program and mechanism so that if people feel like they've been discriminated against within the healthcare that they receive, that they can share it. Why? So that we can do things like what the next bullet calls for, the establishment of respectful maternity care compliance and NICU equity programs to address the bias, one, but then also hold our healthcare institutions accountable for addressing the bias and discrimination reported by families. And then lastly, we are also asking within this policy priority that there be monies made available so that these training programs are tech-enabled learning modules. The recommendation here to offer or to require implicit bias training isn't to take anyone away from the care that they're delivering bedside to a family or to a birthing mom, but it's to complement and supplement, and in some instances, provide a new avenue for training in which none may exist. And we know that we can only do that if it's not live, right, like this, but if you have some opportunity to do it on your lunch break, after work hours, on weekends, etc. And talk to me in the chat, guys. This is meant to be the conversational part of our time together. If you have questions, if you have observations, if you have things that you know work well within your institution, talk to us. We want to make this a didactic conversation at this point through chat. Don't unmute yourself, please use the chat. The second policy priority here is to improve maternal and neonatal health outcomes in the healthcare systems, that they collect accurate data. Please talk to me in the chat. How many of you who are working inside of a hospital, a health insurance company, a community-based organization collect race, ethnicity, language, or social determinant of health data? I'm going to pause here for a moment. Yes, if you're collecting this information. No, if you're not collecting this information. Thank you, Kimberly. I see yes. Ashley is a yes. Any other yeses? Jay, yes, through surveys. Anyone else in the audience collecting race, ethnicity, and language data? I'm excited to see that a few of you are collecting this information, which lets me know that you are in the process, or you've already taken the steps to pair your REL or real data, right? And overlaying it with quality improvement, patient satisfaction, or patient trust measures. This is extremely important in healthcare institutions, because if we aren't able to stratify any of our health outcomes by these data factors, we aren't going to truly understand what disparities exist and persist in our populations, nor will we be able to do things like track, trend, and report a decrease or an elimination of the disparity altogether. More importantly, I'm going to put my Preemie mama hat on right now. If an institution is not collecting and analyzing data and stratifying it by race, ethnicity, and language and the other factors, how are you truly going to create and implement programs and services that meet my cultural needs? Because otherwise you're going to put me in the general category or bucket, and you may miss the fact that after a certain age, I shouldn't be on birth control because I'm on high blood pressure medication. Or you're going to miss the fact that I'm African American, and unfortunately my race, my age, my education status aren't protective factors for me having a preemie. Those are things that put me at greater risk. And so there may be some programs and services that you can put in place to help me in a way different than the general population. Okay. So this is an area that is a really sweet and sore spot for me, for two reasons. One, I spent 8 years of my career inside of health insurance companies, helping them to standardize the collection of this data. And unfortunately, it is not uniform. There is no standard measure or tool that any hospital, that any physician's office, that any organization is required to use to collect this data so that they can track, trend, and report disparities going down. It is a very, if I can use this term on this call, wild west situation that we need to get a handle on in order to move the needle on disparities. Third policy priority is to improve the health of Black preemies. To improve the health of Black preemies, we must increase and expand pathways to diversify the workforce. So many of the Black Maternal Health Caucus advocates that we've had an opportunity to meet with this week are advocating for the diversification of the workforce. Why? Because so many studies are showing that without that racial concordance, care suffers, outcome suffers. And that's not to say that if you're white, you can't deliver good care to Black, Asian, or Hispanic, or if you're Black, you can't deliver good care to white, Black, or Hispanic. We just need to see, one, more faces of color within the healthcare environment. And two, by doing so, we will be able to expand and hopefully expose and see improvements in the health outcomes for the populations who are really struggling in the healthcare environments right now. Just recently, Congresswoman Gwen Moore released a policy statement about the Perinatal Workforce Act that we are really excited about. We've also really recently just seen HHS, the Department of Health and Human Services, provide millions of dollars in funding to get doulas connected to pregnant women. And we've also recently seen legislation that's mandating an expansion of Medicaid for up to 12 months for the postpartum period. All of these things are wonderful. We are just hoping that there will be some high school and some college level students who will be interested in taking us up on our offers to get them exposed to health careers and those careers that are very much so connected to supporting Black birthing women in NICU admitted families. Fourth policy priority is to ensure that Black moms and babies have access to high quality, culturally relevant and appropriate care regardless of their insurance status. As I just mentioned, we've just seen the passage of Medicaid expansion in all 50 states, which makes us feel so old and antiquated. Why wasn't Medicaid expanded for 12 months postpartum before now? I mean, come on, we can afford it. It's a life-saving measure for so many moms. Thank you. In year 2022, we just now get it after seeing the rates of Black moms dying higher in 2021 than we've seen before, and more preemies being admitted to the NICU in 2020 and 2021. But essentially, the connection here to that larger piece of legislation and movement, yes, we are absolutely all for Medicaid expanding because Medicaid covers payment for 1 in every 4 babies born in this country, right? And we know that although Medicaid may be expanded to allow birthing women to have access to insurance for 12 months after they deliver, we still need to ensure 2 things. 1, that it's high quality, and 2, that it's culturally relevant and appropriate. And this is even more important for moms who have babies in the NICU. Okay, so the same principles apply around collecting race, ethnicity, and language data, the same principles that apply around ensuring implicit bias trainings, the same principles that apply around connecting with Black woman-led and Black woman-serving organizations to partner off of what's happening in the healthcare system while mom and baby are still there, apply here. And then lastly, we are asking us to explore improving disparities in the maternal infant health and the well-being of moms and preemie babies to be centered in maternal health legislation. That's the entire point of the Once Upon a Preemie policy note here. We are too far and too advanced of a society to keep these issues siloed and segregated. It is now time that when we talk about the Black maternal health crisis and everything that it entails, whether we're talking about the diversification of the workforce, whether we're talking about collecting data, whether we're talking about scaling programs to improve all those social barriers to making sure mom and baby are healthy and wealthy, NICU needs to be included in that. We should not be having the Black maternal health crisis conversation in April and the prematurity awareness conversation in November. They are directly intertwined and linked. And we know that we are targeting essentially the same populations when we're talking about NICU equity and NICU disparities. We're talking about the same moms who are at risk of dying during childbirth and delivery. And so it's time for us to meld, blend, and connect these two very important issues under one umbrella so that they get the policy legislation adoption that they deserve and the funding mechanisms to move culturally appropriate and culturally sensitive solutions forward for our nation. That went quicker than I thought it did. You guys are really quiet today. So we have more than enough time on here before we end. If anyone has any questions or comments, I welcome you an opportunity to unmute yourselves and let's just have a conversation while we're here and we still have the time.
I just wanted to say, this was great, Janae. I think your policies are very inclusive. I think someone addressed it in the chat, very concise ask. I think that it really activates people to understand the importance of having that language, but also knowing what diversity looks like in the NICU and amongst families who have spent time in the NICU. So I'm just really excited again to be a part of this with you. I invite more people to be a part of this conversation and to continue to normalize it, right? Because we have to create equity in these spaces. Our NICU babies and NICU families are in one of the most vulnerable times of their lives. And we need to know that we have the supports there for them to be able to thrive in that space and not just survive in it, right? So I just wanted to make sure to say that out loud. And again, thank you so much for this space. This is awesome.
Thank you, Jay. Thank you. Any other thoughts, comments, or reactions to the policy note release? Okay, so we do have a comment that we need to extend community resources for post-preemie discharge, home care, maternity leave, and mental health care. Absolutely. We definitely call out the need for making sure that mental health and other community-based resources are available during that postpartum period. A lot of the Momnibus legislation just has very general and very blanket language around postpartum, but for so many birthing women, that postpartum period looks so different, especially as you called out, if that baby hits the NICU like mine did, or you yourself have a health condition that you need to manage after discharge. And so we're hoping that we will start to see the acknowledgement of what post-discharge and home care and transitions look like by having more doulas deployed to families once they deliver in the hospital or at home. But we will continue to build out and expand some of what we have in this policy note because this was just the start. And again, that start was based on all the things we had already been advocating for, leading within this health and healthcare space for the last 6 to 8 years. And this note will transition into a full brief in the near future. But we need to hear from you around the alignment that we have with what we're proposing, with what you're doing and what you know needs to happen. And also some other areas that we just did not cover here, but that we absolutely know we need to wrap some arms around to advocate for. So thank you for that comment.
Can I add to that really quickly?
Sure.
So, while we're talking about creating equity and diversity, we also want to make sure that we're inviting our allies, right? So if this is not your lived experience, I'm not a NICU mom, but I understand the importance of this space, right? Maybe you're not a mom of color, but you still occupy this space and you still have a responsibility to be a part of pushing our equity forward, right? So we want you to also know that your voices are included and instrumental in us pushing this into that normalized space. So we really want everyone to look at this from that space of where is my role? How can I continue to push this forward? How do I keep keeping, how do I keep keeping? How do I keep speaking about this in real time, right? We don't want this to just be a past initiative. We want you to know this is how you put your advocacy into action. These are the steps that you need to take from your space of where you occupy.
Absolutely. And Jay, thank you for calling out that this is not a stagnant one and done opportunity. This is just the beginning for us. As we mentioned, we've been at this partnership exploration conversation for almost 2 years now, and we landed here. And here didn't start on Wednesday, April 13th for us. It started Saturday, whatever Saturday's date was, when Jay led a training with Preemie moms who were looking for a home to share their lived experiences and their voices. And so Jay led a wonderful, almost 4.5, 5-hour training to help these women be able to articulate and vocalize their experiences and what they'd like to see happen and improved in their healthcare environment for future preemie mamas. And so as we're releasing this policy note and we're engaging in the national conversation and dialogue around Black Maternal Health Week, this is just the beginning. We want to keep the energy and momentum going throughout the year. We'll talk about some more things we have going on this week and beyond this week so that we can remain in communication, everyone here and the other allies who weren't able to make it here today, so that we can keep our vision and our voices going. Any other comments or questions? Okay, so Megan, thank you so much for the wonderful question, which is, will there be a follow-up of the asks it in written form you'd like to share with your team? That is absolutely something we welcome. There are no Vegas rules here. What happens here should not stay here. We hope that you do spread this out across your respective teams and organizations. We will absolutely follow up with everyone who joined us here today and everyone who registered who wasn't able to join today with an official copy of our policy note. We hope that you will begin to circulate it and distribute it and post to social media. Please don't be shy about sharing what we discussed here today on social media. We also encourage you to follow along with and support the Black Maternal Health Momnibus of 2021 and whatever future versions of that come about, which we are learning as we walk about the hill, will be forthcoming soon. And we also encourage you to communicate with your congressional leaders to let them know you are an advocate for these issues too. We don't want them to just hear from us during this week, but year round. Those of us who do the preemie advocacy work certainly have a good, space and place in November, but we don't want it to just be one in April, one in November, and then we go away. We really do need this to be a year-round commitment and conversation. Okay. Next, as we mentioned, we certainly have opportunities to engage healthcare professionals in this dialogue and conversation, specifically around implicit bias training. We do, Once Upon a Preemie Academy does lead year-round conversations around these topics and others. We have our e-learning courses that are available online on our website for you to learn more, where we touch on things like just a general intro to health and racial equity and implicit bias, solutions for addressing inequities in the NICU. We absolutely talk about Black mothers' mental and emotional health and Black preemie parents as partners in care. These are wonderful get started, hop to it now training opportunities for both perinatal and neonatal healthcare professionals and of the NICUs and insurance companies and national advocacy groups that have joined us in their implicit bias training journey through our e-learning courses are seeing phenomenal transformations within their NICU and their staff. Okay. We are also excited to continue this conversation this week with Melanated Moms. They have a full suite of daily conversations happening and taking place during this week on finding strength through stigma, childbirthing in communities of color. Each day they are hosting 30-minute Instagram live conversations where they focus on and feature a local Black mama who's leading work in this space. And this Friday on April 15th, Jay, I shouldn't be talking about this, but I'm just going to continue since I'm here. We're going to hang out for 2 hours. Okay. So join us this Friday if you can on Zoom, where we'll be talking about these and other topics. And we are excited because this is just a phenomenal opportunity and way for us to keep the conversation going. Part one, yes, but part two, there are some real dynamos. So Jay and Ashley and Selena and a few other preemie and Black mamas who are on this call aren't the only movers and shakers in this space. There are so many women with lived experience, research, policy, advocacy, program services that I'm honored that Melanated Moms will be lifting up through this webinar this Friday. And I don't know if you guys have ever heard of the app Earth, but we will also be joined by Kimberly Seals Ehlers, who will be talking about her work and contributions to this movement as well. And this is my conversation or my contribution to the event on Friday, where we'll be talking about when legislation meets motherhood. And that's what we've been doing here this week. We are also excited to announce and share with you that we will be hosting our first in-person conference here in my hometown, Philadelphia, November 17th, which is also Prematurity Awareness Day. We just skimmed the surface today. We will be going a lot deeper and further, not only with healthcare professionals who are leading health and racial equity transformation work at the point of delivery, but also partnering and pairing off with parents such as myself and Jay and Selena and Ashley, who I keep referencing, who had the lived experience and are taking action around those experiences. More to come. We hope that you will be open to joining us for this very important and historical time in our organization's history, to take some of what we're sharing back to your respective institutions to close those inequity gaps. We just want to thank you wholeheartedly for your time and hanging out with us on our first policy note release. We don't take your commitment lightly to these issues. I know that together our partnership will eliminate racial disparities in neonatal care, and these are just a few ways that we can remain in touch. I'm just going to check the chat once more. Jay is absolutely dropping gems with the registration link for the Melanated Moms webinar coming up this Friday. And we hope that we will be able to stay in touch with you. Please look out for an email from my team, later on today with information, one, about the policy note. We will also share information about the upcoming Melanated Moms webinar and our conference in November. Thank you so much again, everyone, for your time, your talent, your commitment, and dedication to this issue. We need you as advocates. We need you as allies. We need you as friends. We need you as sponsors. We need you as supporters to continue to drive disparities down for Black birthing women and NICU admitted families. Thank you so much, everyone, and have a great rest of your day.